If you or someone you know has cancer and are undergoing conventional treatment such as chemotherapy, you should know that hearing damage is possible. But there are natural ways to prevent it. And if you are already experiencing some sort of hearing damage, there are also some natural options that can help to reverse this as well, potentially. So stay tuned for a thorough, but actually pretty brief presentation on things to prevent and treat ototoxicity, that is damage to the ear caused by toxins such as chemotherapy that may result in hearing loss or tinnitus. So, hi, I'm Dr. Lisa Mateka, naturopathic doctor, energy worker, and transformational life coach, and I help those with cancer navigate their inner journey back to health and wellness to an even better state than before, physically, mentally, emotionally, energetically, and maybe even spiritually, with compassionate guidance and loving support. So, ototoxicity, as I said, that's just a word that means damage to the ear from toxins such as chemo that can result in hearing loss or tinnitus. So, this happens typically from platinum based chemo, and the most common ones are carboplatin and cisplatin. So, if you're doing carboplatin or cisplatin or are going to, then you definitely want to pay attention to this. How can we prevent this from happening in the first place? Maybe you didn't start your treatment yet, or you know someone who's about to. So, I'll have to say this first. It's not a bad idea to get a baseline hearing evaluation by an audiologist, and then also to do it during treatment and then another time after treatment. This just helps for an accurate, tracking and assessment. But one important thing, and sometimes this is all it takes, but regardless, you definitely want to be sure you are adequately hydrated. So, ensuring adequate hydration is one of the keys of prevention. Adequate hydration. It really is amazing all the things that water does. Of course, I also want to recommend really clean, good water as well. And then one of the big things that I love using in my practice is rosemary. Rosmarinus officinalis, rosemary. Rosemary can actually prevent ototoxicity. It can prevent damage to the ear. It can prevent all the things that comes with that, hearing loss, tinnitus, by preventing the apoptosis of the primary organ of Corti and auditory cells. So basically, rosemary can prevent the dying off of the primary organ of Corti, which is a structure located in the cochlea that's responsible for the transduction of sound, and auditory cells. It also prevents the dying off of auditory cells. So rosemary is an awesome thing. Okay, so how do you take it? Well, there's many ways, and I'm not really going to give I'm going to give dosing actually for a good amount of this stuff, but not for everything. With rosemary, it really depends on the form you're taking, the dose of the chemo. So if you're just doing rosemary tea, that might not be enough. For some people it is, but I usually like to recommend something stronger. So rosemary tincture is strong. Rosemary glycerite is pretty strong. You can also get rosemary capsules, which is like dried up powdered rosemary herb. And I recommend taking a good amount of that. Okay, so what if you already started treatment? What if you already have what seems to be some hearing loss or hearing damage, or the ringing in the ears, tinnitus? Some people say tinnitus, but it's pronounced tinnitus. Okay, so grade 1 or 2, and I'm not going to get into the exact parameters of what grade 1 or 2 ototoxicity is, but basically, generally speaking, it's like a mild to moderate tinnitus and or mild hearing loss with or without a hearing aid. So if you have a grade 1 or 2 ototoxicity, you can treat, again, with the rosemary. Rosemary is great for prevention, and also you can use it for treating. And a lot of times this hearing damage will reverse anyway, but sometimes it doesn't. So it really is good to do what you can. And we have all this beautiful natural medicine at our disposal. So, rosemary, like I said, it's like my favorite to use. Another thing that I found that I found a study on this. Um, it's a combination of CoQ10. So CoQ10 is like shortened for coenzyme Q10, which is basically an antioxidant. CoQ10 taken with a multivitamin. And what is really important about the multivitamin is that it has adequate amounts of vitamin B1, 2, B6, B12, and E, along with melatonin, which is a hormone we produce. People think of it being for sleep, but it does other things too. Ginkgo biloba, the herb ginkgo biloba, and lactium milk protein hydrolysate, which I know that's a weird one. So basically it was this combo of CoQ10, multivitamin, melatonin, ginkgo biloba, and this lactium milk protein hydrolysate. And that was taken orally every day for 3 weeks. So that's all that was needed, 3 weeks. Another thing that has been shown to help treat it, taken orally, and really I would do as many of these as possible. Vitamin E, 400 milligrams daily, and that's alpha tocopherol. Okay, the next two are amino acid derivatives, amino acids. So we have acetyl L-carnitine, acetyl L-carnitine, and you're going to want to take this at 1 gram 3 times a day for a total of 3 grams a day, but split into 3 doses. So like a gram morning, afternoon, and evening of acetyl L-carnitine, which is a lot of acetyl L-carnitine, honestly, but this is the dose that it takes based on studies. Or you could get acetyl L-carnitine at just 1 gram a day, but IV. And of course, if you're doing IV, you have to find a naturopathic clinic or some kind of holistic clinic that can do this for you. And then we have N-acetylcysteine. And we think of this as being good for the liver, which it is, but it's good here too. And this is actually a topical solution, a liquid solution to put in the ear canal itself. So you find a 2% L-N-acetylcysteine liquid solution, which again, this might not be something you can just find on your own. You may have to have it ordered by your naturopathic doctor or health professional of some sort. And it's basically 2 to 3 milliliters that you put in the ear, actually split 10 minutes apart, 30 to 60 minutes before chemo. So basically, half hour to hour before chemo, you do like 1 to 1.5 milliliters in the ears. Wait 10 minutes, let that soak in, put another 1 to 1.5 milliliters in the ears, and it is of the 2% N-acetylcysteine solution. So that's pretty cool. Resveratrol can also help. Resveratrol, that's the polyphenol found in things like grape skin. And this one, I'm not sure the exact dose. I usually, like I said, I usually stick with the rosemary. I'm not sure the exact dose on the resveratrol, but animal studies, and this one, the studies have only, the ones I said before, there's studies on people. This one, there's only been studies on animals, and the animal dose is 10 milligrams per kilogram, and they did an intraperitoneal injection. So you'd kind of have to figure you would take basically more if you're doing an oral dose. And an intraperitoneal injection, that's used oftentimes in animal studies. That's like injecting into the abdominal cavity. But anyways, the point is resveratrol shows promise based on animal studies that it can also be helpful for restoring hearing. And another one, IV, is IV hydration. So this again is going back to the hydration. Even just doing something as simple as like an IV hydration solution can help to reverse and treat the hearing loss, damage, or tinnitus from chemo. So that's a cool thing. And also just another reminder to just stay hydrated. Being hydrated really can help. And then acupuncture. Acupuncture can actually treat this as well and has been shown to be very useful as well. And then if you have a more serious form of this, if you have grade 3 or 4, you may need drugs, and grade grade 4 is bad. That basically is like urgent medical attention. That's basically an emergency. So it usually doesn't get that bad. It can, but it is always good to try to prevent with some of these things. I hope you enjoyed these monthly editions of how to treat the side effects of conventional treatment of cancer using naturopathic, integrative, and other natural complementary alternative forms of medicine. But what about other more powerful ways of healing the cancer itself other than conventional treatment? Well, there are ways, and I have a free gift for you. If you click the link in the description box, you will get my free gift. It is an article I wrote. You could call it a short ebook. It's like a 38-page free guide, very easy to read, big font, pictures, and it's called The 10 Common Healing Factors Among Cancer Survivors Who Beat the Odds. And if they can do it, so can you. So basically, it is a summation of Kelly A. Turner's work, which is decades of research on cancer patients who had spontaneous remissions, and she basically compiled data on them and then found the 10 things they all had in common. So you can start doing these 10 things now. And who knows, these are the common links for those who have a spontaneous remission. So it certainly would increase your chances, and it's a really good place to start when it comes to taking charge of your health and starting to choose treatments that may help you, that you believe in. This is, scientifically validated stuff, but it's also empowering because it's a lot of this stuff are things you can do on your own. And so arm yourself with this knowledge and power and get your free guide today by clicking on the link in the description box. And I guess I'll see you next time then. Thank you for being here, lovelies. And please like, follow, and all that kind of stuff just because it helps the algorithm so I can reach more people. Thank you. Bye.